How does Sunitinib, Sutent, treat GIST stomach cancer? Imagine a tiny army working inside your body to fight a tumor. Sunitinib, also known by its brand name Sutent, is a medication that helps control certain stomach tumors called gastrointestinal stromal tumors, or GIST. These tumors often develop because of mutations in specific proteins that tell cells to grow too fast. The main targets of Sunitinib are mutated forms of proteins called receptor tyrosine kinases, especially KIT and PDGFRA. These proteins act like switches that, when turned on by mutations, make the tumor cells multiply uncontrollably. Sunitinib works by blocking these switches, which slows down or stops the tumor from growing further. In addition to blocking these proteins, Sunitinib also targets blood vessel growth. Tumors need new blood vessels to supply nutrients and oxygen, helping them grow bigger. Sunitinib inhibits a group of proteins called vascular endothelial growth factor receptors, or VEGFRs, which are essential for forming new blood vessels. By doing this, it effectively starves the tumor, making it harder for it to survive and expand. Sunitinib is especially useful when the first treatment for GIST, called imatinib, stops working or causes intolerable side effects. Sometimes, tumors develop resistance to imatinib because of additional mutations in the KIT gene. Sunitinib can often overcome these resistant mutations, particularly those involving exon 9 of the KIT gene. It is usually prescribed at a dose of 50 milligrams daily for weeks, followed by a 2-week break in a repeating cycle. Some doctors may adjust the dose or schedule based on how the patient responds and tolerates the medication. While Sunitinib has shown to improve how long patients live without the disease progressing and can shrink tumors, resistance can still develop over time. This resistance often results from secondary mutations in the tumor's KIT gene, which make the tumor less responsive to the drug. Researchers are actively studying these resistance mechanisms to find new ways to keep the treatment effective. In summary, Sunitinib treats GIST stomach cancer by blocking the mutated proteins that drive tumor growth and by preventing the formation of new blood vessels that feed the tumor. It is a valuable second-line option for patients whose tumors no longer respond to initial treatments. As always, patients should work closely with their healthcare team to determine the best personalized approach and to manage any side effects. Remember, every case is unique, and ongoing research continues to improve how we fight these tumors.